One of the things that has gotten the Republicans very concerned is that Democrats are running on providing some type of material benefit to voters, that being Medicare for all. Now, they are desperate to try and figure out a way to make Medicare for all seem like a bad thing. And it's very difficult. It's very difficult for them because 1/4 of Americans, give or take, maybe a little bit more, are already on Medicare. And they like it. They like it a lot. And the idea of, in Bernie's Medicare for All plan, for instance, others, it varies a little bit, paying nothing for health insurance, and at the very least, not having to deal with all the forms and haggle every time you go to the doctor and have it being basically like an accounting course, is highly preferable to the system that we have now. And so they're trying to figure out how they can sell that Medicare for all is bad. And the only way they can do it is to say that Medicare for all is, in fact, not Medicare for all.
President Trump has been committed to making healthcare more affordable and bring more choice, more transparent, keep the patient in the driver's seat. People who are promising Medicare for all. That's one of the big ideas now people keep talking about. Medicare for all is Medicare for none. These are the same people who brought you Obamacare, but this time they're not even making the promise that you can keep your health plan.
Pause
or you
it.
can keep
Medicare. First of all, Obamacare is at its height of popularity. And which is not to say that I think a broad base of people don't realize that it needs to be improved. But understand what Medicare, what Obamacare is. There are less than 10% of the public who buys insurance through the Obamacare exchange. Far less than 10% of the public. The number of people who are getting health insurance through expanded Medicaid is probably around the same in terms of sheer numbers of people. The only thing that impacts people broadly from Obamacare are the patient protections. Remember, it was the ACA PPI bill. The patient protections, like you can't be denied because of pre-existing conditions. You can't be subject to rescission. You get a certain number of basic amenities to qualify insurance as actually being insurance. You're allowed to stay on your parents' plan until you're age 26. These patient protections are under threat by a Republican lawsuit. 20 states have joined the state of Texas. 19 states have joined the state of Texas. And Trump's own DOJ is not defending this case. So it's a little bit difficult to win. They will have those all taken away from you. So Obamacare is at its height of popularity, yet Democrats know that it's not enough and are going out and offering Medicare for all. So who brought it to you is irrelevant, but it's being brought by a slightly different group of people, some of whom have signed on. Others, but continue.
Keep your doctor, because they know that's not the case. The 178 million of us who've got employer insurance, that would go away under some of these proposals. Your doctor, you wouldn't get to keep your doctor because your doctor would flee these Medicare lower rates and we'd have a two-tier system of health care.
Pause it. I want you to contemplate this now. 178 people move on to Medicare. 178 million. Plus the, 40 million that are on Medicare now, maybe 45. So the vast majority of the country is on Medicare. These doctors are going to flee providing service to the 90% of people in this country who will be on Medicare, right? 10% maybe they'll be eligible for Medicare. They'll get Medicare, but they're also going to get private supplementary insurance. Maybe 10%, right? The super wealthy. Maybe the top 5%. So I don't know where, all these doctors are going to move to one neighborhood, Chevy Chase, Maryland, and they're all going to serve. Like every one of these wealthy people are going to have their own personal doctor. The doctor's only going to work for them.
Bringing back house calls.
Exactly. House call. You don't even have to have a house call. They're just going to live in the driveway and service each individual person. That is the only way your doctor will not be available. The only possible way. It doesn't make any sense. Like, it's not possible. What he's saying to happen is not possible to happen. Certainly there's going to be supplemental insurance. Certainly there's going to be private insurance that may pay doctors a premium over their Medicare, but there's simply not going to be enough of those customers for doctors to say, I'm going to leave the Medicare system. That's the whole point of Medicare for All. That's why it will control costs. That's why it will be cheaper for the country. That's why you have Medicare for All.
Lower rates, and we'd have a two-tier system of health care where they move into a cash system outside of this Medicare. So America's seniors would lose their doctors. They could lose their hospitals.
Pause it. Why would American seniors who are getting their doctors through Medicare now lose their doctors under a system of Medicare? When 3/4 of the country already is in a private system, why would they lose their doctors? It doesn't make any sense. Is there any more? Is that it?
That's it.
Yeah, he's grasping there.
Oh, yeah.
The thing people don't like about Obamacare is the part where they still have to pay for health insurance.
Exactly.
I mean, that goes without saying.
The patient protection part actually delivered. It was the affordable care part that didn't.
The most popular healthcare program in the country right now is probably Medicare and Medicaid. I believe it
the
has
VA is probably the most popular, and then I would say Medicare.
And 75% of Americans approve of Medicaid and Medicaid expansion. So they see the writing on the wall, and they're going to their base, which is going to be, they're going back to senior citizens on Medicare who are saying, hey, the death boards are coming back.
This has been, relatively successful for them in the past, so I'm not surprised they're doing it.
And he talks about choice in insurance plans, like that's a good thing. Like, do you know anyone who enjoys trying to choose from the many confusing options?
Absolutely.
I want to choose the one that I don't have to pay anything for.
That's right. All right, we'll turn on IMs just for a second.